Hi, I'm Mike mruger. I'm the managing partner at Greenbush Financial Group. As you approach age 65, there's some important decisions that you're going to have to make regarding your Medicare coverage. Now, because Medicare Part A and B by itself has deductibles, coinsurance, and no out-of-pocket maximum, retirees will often select either a Medicare Supplemental Plan or a Medicare Advantage Plan to help manage some of those costs that are not covered by what's called Original Medicare. But the problem is most retirees don't even understand the difference between Supplemental Advantage Plans, which is what we're going to cover today. And I would argue that this decision is probably one of the more important decisions you're going to make, because selecting the wrong type of plan could lead to a lot higher medical costs, prescription drug costs, or gaps in coverage. And for many states, you're going to get one shot at this decision. So before we get into comparing the two types of plans, we first have to have a good understanding of Medicare Part A and B, which is what's considered Original Medicare. And those are the benefits that are provided to you by the government. So Medicare Part A is for your inpatient services, so when you go into the hospital. Now, Medicare Part A does not have any monthly premiums that you pay, but it does have deductibles and coinsurance, so there is cost when you get admitted to the hospital. Now, Medicare Part B, that's for your outpatient services. So think doctor's visits, lab work, medical equipment. Now, unlike Part A, Medicare Part B does have a monthly premium that you pay. And most individuals in 2020 will pay about $144 per month as soon as they're enrolled in Medicare Part B, which normally comes directly out of your Social Security or railroad benefits. Now, the main issue with Part B is it also has a 20% coinsurance for all expenses billed to Medicare Part B. And what that means is any doctor bills you get, you are on the hook for 20% of that. So if you get a $50,000 doctor bill, you have to pay $10,000 of that out of pocket as part of that 20% coinsurance. And with Original Medicare, there is no out-of-pocket maximum. So if you have something catastrophic happen during the year, you have to keep paying without any limit, which is the main risk. So retirees will help manage some of these cost gaps not provided by Original Medicare by selecting either a Medicare Supplemental Plan or a Medicare Advantage Plan. Now, both of these types of policies are provided by private insurance companies. So remember, Original Medicare, that is provided by the U.S. government. These Supplemental Advantage Plans, it's actually private insurance companies that are now coming into play that you could potentially have to pay an additional monthly premium to get this additional coverage. But to start off, we'll start off by talking about Medicare Supplemental Plans, which are also known as Medigap. So these Medicare Supplemental Plans, as the name suggests, it supplements your Original Medicare benefits. So you still have Medicare Part A and B, you just purchased this additional insurance policy for a monthly premium, and that fills in a lot of the cost gaps that are not covered by Original Medicare. And there's a bunch of different plans you get to choose from that range all the way from Plan A all the way down to Plan N. So if you look at this chart, this shows you the different types of Medigap plans that are available on the market. The two most popular options that we see for clients are Plan G and Plan N, but you'll see how there's varying levels of coverage, and anytime you see 100% in a given column, that means that that particular Medigap plan covers that cost 100% that is not otherwise covered by Original Medicare. So the important thing to know about these Medigap plans is they are standardized plans, which means the benefits associated with each type of plan is set by law. So if I want a Medicare Supplemental Plan N, if I go to insurance company X to get that plan or insurance company Y to get that plan, the benefits are going to be identical. The only difference is going to be the price, because the government does not set what they can charge for those plans. So if I go to insurance company X, they could charge me $150 per month. Insurance company Y might charge me $250 per month. Same exact plan, just a different price. Now, depending on your zip code, you might have 5 insurance carriers in your area that offer Plan N, or you might have 15. The benefit of working with an independent broker like ourselves is we can run quotes based on all the insurance carriers in your area and pinpoint the one that has the lowest cost for the type of Medigap plan that you're looking for. The other thing I will issue a warning on is a lot of people will do this when they're first signing up. So they'll say, hey, I want a Plan N, let's run the list, and this is the lowest cost provider, and then they never look at it again. Sometimes insurance carriers will do a teaser year, which means they drop the price on their Medigap plan just to get a bunch of people in the door, knowing that in future years, they're probably not going to shop this thing every year, and the next year they raise their premium significantly and they're no longer the cheapest provider. So each year, you have to kind of be looking at your plan and the providers and the costs in the area to make sure you're still getting the best plan at the lowest cost to you. One of the largest benefits associated with having a Medigap plan is freedom of choice. You have the freedom to see any doctor, specialist, go to any hospital that accepts Medicare. You don't have to worry about asking them, do you accept insurance from XYZ carrier? If they accept Medicare, you're covered by the services covered by your supplemental plan. Because what the doctor does is they bill the services to Medicare. Medicare will cover its costs, and anything not covered by Medicare will be passed on to your supplemental plan, and then they will pay anything that's covered by your plan. They don't have the option to refute any claims that are covered by the plan that you've selected. They are forced to pay it. So if you go this Medicare supplemental route, you will also need to add a Part D prescription drug plan, because original Medicare and supplemental plans don't provide any type of drug coverage. That's what these separate Part D plans are for, which are also provided by private insurance companies. So essentially you got your Part A and B from original Medicare, you have your supplemental plan to fill in the gaps not covered by original Medicare, and then you have your separate Part D plan, which provides all your prescription drugs for that separate monthly premium. Now let's shift gears over to Medicare Advantage Plans. Now, I'll say this loud and clear again, like Medicare Advantage Plans and Medicare Supplemental Plans are not the same. We'll all too often ask clients, what type of coverage do you have? And they'll tell us, oh, I've got a supplemental plan, only to find out that they really have an Advantage plan. And there's a lot of significant differences that you should be aware of. So the first and foremost thing is, if you enroll in a Medicare Advantage plan, it is replacing your Medicare coverage. You are no longer covered by Medicare. All of your health care insurance is dictated by that insurance company that's sponsoring your Advantage plan. Now, there are pluses and minuses to Advantage plans that we're going to go over, but it's really important to understand the differences and some potential restrictions before enrolling in these types of plans. One of the most common reasons why individuals select Medicare Advantage plans over Medicare Supplemental plans is cost. These Medicare Advantage plans can be a lot less costly per month than the Medicare Supplemental coverage, which offers a lot more comprehensive coverage and flexibility as far as the providers that you can see. There are even certain types of Medicare Advantage plans that have zero premiums, which means you don't pay the insurance company anything per month. And my biggest question as I kind of learned about these Medicare zero premium plans is like, how does the insurance company make money if I'm not paying them anything? Almost like, what's the catch? But what I found out as part of our research is, remember that Medicare Part B premium that you pay to Medicare as soon as you enroll, that $144 per month? So if you're in an Advantage plan, you actually still have to pay that $144 per month to Medicare, but Medicare passes that through to the insurance company that's providing you with your health insurance. So that's one way the insurance company is getting revenue. But the bigger way that is less known to individuals is, as soon as you enroll in a Medicare Advantage plan, the government starts issuing checks to that insurance company each month, and it varies a little bit by the area that you live in, but in our area, it's over $700 per month per person that they have enrolled in one of the Advantage plans. So not only getting the $144 per month from Medicare Part B, but they're also getting this in $700 per month directly from the government, because it got you out of the Medicare system and now they're fully covered by this Advantage plan. So the insurance company is making plenty of money providing it to you at $0 per month. Now, it's for this reason that a lot of insurance companies want to sell you an Advantage plan because they get more money, both from Medicare premiums and these payments from the government. So you have to be really careful if you go directly to an insurance company, because also not all insurance companies offer Medicare Supplemental Plans. If you go directly to an insurance company to say, hey, what's my Medicare options, and all they offer are Advantage plans and they don't offer supplemental, that's probably all they're going to talk to you about are Advantage plans, even if supplemental might be the right fit for you. And that's why we're doing this video, is to make sure you fully understand before you make that decision whether supplemental is the right fit or whether Advantage is the right fit for you. Medicare Advantage plans really come in two flavors: HMO plans and PPO plans. If you go into an HMO plan, you're really required to stay within that provider network of that insurance company. If you go outside of that network, you could be on the hook for the full cost of those services. Versus a PPO plan that allows you to go outside of that insurance carrier's network, but it could be at a higher cost. Those PPO plans, they have a network similar to HMOs. If you stay within the network, usually those services are provided to you at a lower cost. You go outside of the network, there is coverage, but usually you pay more in the form of higher copays, deductibles, and coinsurance. And as you would imagine, the more flexibility you have, usually the higher cost that plan is. So typically PPO plans are more expensive than HMO plans on a monthly basis. Unlike Medicare Supplemental Plans, Medicare Advantage plans are non-standardized, which means each of the plans are different from insurance company to insurance company. And also within one insurance company, they could have 4 or 5 plus different Advantage plans to choose from. So you really have to do your homework to make sure that your doctor's specialists are covered by that particular plan, and also be aware if there was ever something that big that happened during the year medically, what are the costs that could flow through to you or that could potentially be out of pocket depending on the plan that you have chosen. Another difference between Medicare Supplemental and Medicare Advantage plans is Advantage plans have the prescription drug coverage typically wrapped into that individual plan. Remember I mentioned with supplemental plans, you got to get your supplemental plan and then you have to obtain your separate Part D plan. With Advantage plans, they usually have the drug coverage included in that total plan for you. So you really have to make sure not only does that plan meet your doctor and health needs, but also are the prescription drugs that you're currently taking also within that plan. Because these Advantage plans incentivize you to stay within the network, both for HMO plans and PPO plans, to lower the overall costs, you really have to stay on top of changes that they make to the network, which they can do each year. So if an insurance company is going to change doctors or prescription drug coverage for the upcoming calendar year, they will notify you by September 30th of the changes they plan to make for the next year. And what that does is if you find that your doctor is no longer covered within your current Advantage plan during the open enrollment period, which lasts from October 15th to December 7th, you can then look for another Advantage plan that then covers your doctor or prescription drugs and make that change for the next calendar year. One of the other features that makes these Medicare Advantage plans popular are some of the additional benefits that they offer to policy owners. So some of these plans will have like the Silver Sneakers benefit, which pays for gym membership. They'll cover some vision costs, dental costs, hearing aids. You really have to look at plan by plan, but usually there's some additional benefits that are not necessarily offered by Medicare Supplemental Plans. One of the nice features associated with these Medicare Advantage plans is they do offer some max out-of-pocket protection. So remember when we were talking about original Medicare A and B, that if you have no additional coverage and you have a catastrophic health event, you can be required to keep paying money all year long with no ceiling. These Advantage plans are required by Medicare to have a ceiling on the amount that you are required to pay out of pocket as long as you stay within their network. And for 2020, that dollar limit is $6,700. Now, if you go outside of their health network, there might be no limit, but at least it offers you some protection in those cases. Now, certain insurance carriers will voluntarily choose to lower that threshold, but it doesn't apply to all plans. Now, every now and then we will get pushback from clients on the supplemental side saying there's no maximum out of pocket. Now, with a lot of supplemental plans, that's true, but you also have to remember the supplemental coverage is a lot more comprehensive. So typically maximum out of pocket does not become an issue depending on the type of plan that you've chosen to cover you over and above your original Medicare coverage. So there are some special options that residents of New York and Connecticut have that people in most other states do not have, and we're going to go over those here. So the big thing is when you make a choice to either select a Medicare Supplemental Plan or a Medicare Advantage Plan, if you live outside of New York or Connecticut, any other state, a lot of times that is a one-time decision. And the reason being is if you elect a Medicare Advantage Plan, which you leave the Medicare system, your state insurance laws might allow those Medicare supplemental providers that if you want to come back to Medicare in a supplemental plan, they can allow them to do underwriting, which can either deny you coverage entirely or charge you an exorbitant premium to get back in one of the supplemental plans. And that's what's different about New York and Connecticut is we have insurance rules within our states that say insurance companies aren't allowed to do that. So in any given year, if you live in New York or Connecticut, you're allowed to switch back and forth between supplemental and advantage plans without big penalties or denial of coverage. So I really stress that if you live in one of these states outside of New York or Connecticut, you have to be additionally careful with when you make your selections, because if you go with a cheaper advantage route, you might not have the option to return to a more comprehensive supplemental plan if your health needs change in the future. As you can see, there's a lot of variables that come into play as you're trying to determine what the right Medicare solution is for you. And I can't stress enough, it is an individual by individual decision. Just because your friend, your neighbor, your coworker selected a specific type of plan does not necessarily mean that is the right plan for you. And we've even seen extreme cases where one spouse should be in a supplemental plan and the other spouse should be in advantage because of difference in their health status. Like, we are an independent Medicare broker, which means we're not tied to a single insurance company. We are here to help you vet your options, to simplify the process of enrolling in Medicare and selecting a plan that best meets your needs and your budget. Whether that plan is $34 directly through the insurance company, that plan is $34 even if we offer it. So there's really no cost to work with us. Like, we're just here to help. So if you have any questions, feel free to reach out to us at moneysmartboard.com. Thank you.